Hi, everyone. I'm so excited to have Dr. Blumenthal in today. I refer to him as Dr. B. We have a history, which we'll get into.
Yeah, we do.
Yes. So how are you?
I'm doing great, Dr. Rell. How are you?
Good.
Good.
I'm doing really good.
Awesome.
So Dr. Blumenthal is a urologist by trade, and right now I like to call him the edge saver because he saves edges now. So I'll just quickly read through your history. Dr. B graduated from Eastern VA Medical School. After medical school, he went on to secure a urology and general surgery residency at George Washington University, and then went on to practice urology at Central Maryland Urology Associates for 10 years, while also being director at the Central Maryland Urology GIFU Center for 9 years. Dr. Blumenthal gave all this up to pursue hair transplants at Natural Transplants Hair Restoration Clinic. So let's take a few steps back, right? Let's go all the way back to our icebreaker. So the icebreaker question for you is, what was your very first job before stepping foot into a college campus?
Well, you didn't tell me this was going to be part of the podcast, too. I thought that was just the icebreaker to have fun. So
sorry.
my very first job was I owned my own lawn service and dog walking service. So it was KB Lawn Service and Dog Walking. And at that time, we actually had business cards. So I printed out some business cards, and my grandma and I went in 50-50 to buy a lawnmower. And I paid her back with some of the proceeds. And I had 8 or 9, maybe 10 clients at one point. It was the start of my lawn empire, which ended after a season or two, but it was fun at the time.
That's awesome. Yeah. That's so cool.
Nothing like a 12-year-old to get some cash, that's for sure.
I'm sure, and you probably spent it all on candy and ice
cream. I probably did.
That is so funny. So you've been a person to go about and do your own thing anyway. It seems like that's just a part of who you are.
Yeah, I didn't realize it till we talked about it, but yeah, I guess I had it in my blood early on.
That's awesome. So why don't you tell us why medicine? You seem like you've been an entrepreneur from the start. So why did you choose to get your medical degree?
Yeah, it's a question I get asked a lot, especially why urology. I think it's sort of a two-part question. I think there's a surface answer, and then one that, as of late, I think is a little deeper. But the surface answer, which you hear a lot from a lot of doctors, is I like helping people, and I grew up wanting to help people, which is true. In that part, I do enjoy. I was also very good at math and science, and it came very easy to me, and I liked that. So it was sort of an easy avenue to follow, the path of least resistance. My grandfather also was one of those old-time country docs down in Southern Virginia, and although I never met him, he died before I was born, but it's sort of his legacy, kind of ran in the family, so that was sort of a big impact for me.
Wow. Was he into urology as well?
He was one of those. They did everything, delivered babies, and the only doc in 100-mile radius. So they had to do everything back then. No real subspecialties back then. What I have realized as of late, though, I think there's a sort of a deeper reason. As you probably know, as I'm learning, there are events that happen in childhood that have a large impact and can affect you as you get older and affect your behaviors and who you marry and how you interact with your kids and what job you choose. And my parents divorced when I was young. I was probably about 6 years old, and I had a stepfather that came and went pretty quickly after that. So I am pretty sure I developed some issues with abandonment. And in what better profession is there than being a doctor if you have abandonment issues? So there's always a line of people that want you and are depending on you, and so I have a feeling that had a lot to do, with it from a subconscious level. But yeah, that was sort of my path.
Wow. Yeah, absolutely. Even some of the other guests that I've had on the show, that's similar reasons to why they want to pursue medicine. It's a sense of importance. It's a sense of belonging. And so why urology?
That's a good. So I don't know the deeper answer for that yet. Maybe next year when I do a deeper dive on my own psyche, I'll have a better answer. But from the superficial answer,
Yes. The
I always thought
coins,
the
the
right.
money.
Well, no, not necessarily. At all. At the time, no. I thought that I always thought I was going to go into pediatrics. That's sort of what I
Wow.
was always sort of geared to going. I love kids, and I did my pediatric rotation, and I did not enjoy it. And I actually really enjoyed my surgery rotation, which was a surprise because I hated blood. I would faint at the sight of blood. I didn't like broken bones. All my friends would always tease me about it. So that was a shock to me. I loved my anatomy course, just sort of how things worked, and that was fascinating to me.
Wow.
I did not want to go into general surgery, however, but I did. Through my the medical school, I did befriend a few urologists and went to see a couple of urology surgeries, and it was really exciting to me. You get to use lasers and computers and robots and all these high tech equipment. You could do surgery, you could be in the clinic. Sort of had a good mix for me.
Yes.
And so that's sort of what attracted to me. The other thing, and I think there's sort of a little bit deeper. It's one of the few specialties where you can make a difference immediately. There was a lot of sort of immediate gratification, immediate help versus just managing medicines and diabetes and high blood pressure. This person has a kidney stone. I can go up, grab the stone from the kidney, pull it out, and voila, they're better. So
Yes,
that probably had a lot to do with it as well.
Wow, that's awesome. That's
Yeah.
awesome. So all of these amazing experiences you've had from your grandfather being the local holistic and medical doctor, I'm sure. From you deciding medicine due to your own personal experiences to urology, from the fun and excitement of instantly helping people, which is
Yeah.
kind of what you do now. So why don't we talk about that? Tell us about how you were introduced into the hair restoration industry. What prompted the switch? Why did you say, yes, I'm all in?
It was not something I knew anything about, to be honest with you. It was so Dr. Huebner is a buddy of mine from medical school, Matt, and so we've known each other for a long time. So I knew it has existed over the last 10 years or so since he's been doing it, but it's not like it was I grew up wanting to be a hair transplant surgeon. I think over the several years prior to me changing, I got burned out, and it was a way for me. Switching was a way for me to really reclaim my life and reclaim the joy in medicine and joy in my life. I think my job had become my life. Now my job is a part of my life, and it has allowed me to do so many other things and find joy again. So I think I lost the joy of helping people and the joy in medicine. I remember there were several instances where I would be with a patient. I wouldn't outwardly express this, but in my head, I had animosity towards the patient for taking too much time or not getting to the point. I had 3 other patients waiting for me. That was a huge red flag. Almost every morning I would be in my car and just wishing, at the parking lot and wishing I could just fast forward 10 hours or 12 hours so I could be driving home. The huge blinking, warning, hey, this may not be healthy.
Yes.
That was a big factor. I said, is this really what I want to be doing for the rest of my life? Around the same time, my father passed away, and like that obviously can be a big factor in taking stock in your life and sort of reevaluating, as a lot of people are doing now during COVID, and sort of saying, hey, is this really what I want to be doing? And so the answer to that was no. In my home, I had young kids at the time. They're still relatively young, but I wasn't really there to see them grow up. I was gone before they woke up, and I only had maybe an hour or so at night to be with them. And
again, all over again,
from a deeper level, I think I was repeating some generational stuff that my dad had done to me and wasn't there, and I didn't want to do that to the kids, and I missed them. And being on call and working nights and working weekends, and my commute was getting longer, and my wife and I, she was busy working as well too, so there really wasn't a whole lot of time for us. So it was me really just reclaiming my life and my joy. Yeah.
That's awesome.
Yeah.
And so I know you said your friend Matt introduced you into the practice. So how, like, one day he just called and was like, hey, I have this practice, come join me. And you were like, yes. Like, tell us exactly how that happened.
Not quite. It took a little longer than that, but I mean, there are a bunch of buddies from medical school. We up till COVID had gone, we go skiing once a year together, and we all keep in touch. And we all had made fun of Matt, for a couple of years, teasing him that he's not a real doctor. If you don't work 80 to 100 hours a week and, slave away, you're not a real doctor. And he is so passionate about what he does, doing hair transplants. Yet he also has a life outside, and he goes on awesome trips and enjoys himself. And, so we sort of always gave him a hard time about that, probably because we were jealous and wanted that as well too. But, I had shared with some of them just my frustration, and he said, hey, come check this out and see if you like it. They were opening up an office in the DC area in Bethesda, Maryland, where I live. So he said, if you like it, this would work for everybody. And so I went and checked it out. And admittedly, at the beginning, it was very self-serving. It was much more of a change for me, and like I said, a quality of life change. As I did it more and more, I saw the impact, and it was awesome. I mean, it is truly amazing how you can help people and really change people's lives for the better. And Matt had told me initially he was an ER physician for about 10 years prior to him burning out and then going into hair transplant. And he said it's interesting that he feels more more joy in helping people now than he was when he was literally saving lives in the ER. And I feel the same way. I wasn't necessarily saving lives on a regular basis, but I find it much more impactful in helping people more now than I did before. So it took me a while to sort of make that change, and we can talk about that, but it was not an overnight decision, that's for sure.
Okay. Yeah. And that's so awesome that you mentioned lifestyle, because I think a lot of times we may pick careers, or we feel like because we work harder that our lives we're important because we work harder, or because we're a doctor or a scientist or work in a hospital that we're important. But what's really important is the things that make you happy and that make you feel whole as a person. So I'm so glad that you emphasize that working 80 hours a week, or maybe saving lives in the ER, it could be totally fulfilling to someone else. But, identifying for yourself that being home more with the kids or your wife, or just being present is way more valuable than a title or driving into a hospital every day. So, so glad that you shared that.
Yeah.
So, as you mentioned, it didn't happen overnight. So, what training did you have to complete to make the transition? Why don't you talk about that?
Yeah, so the hair transplant surgery is not one of the specialties of the American College of Surgeons. There are 14 specialties. The hair transplant surgery is not one of them. General surgery, urology, plastic surgery, OBGYN, ENTs, there are 14 of them. Hair transplant surgery is not one of them. So because of that, I consider it more of kind of a cosmetic surgery. It may fall under the plastic surgery umbrella, but you don't have to go through a residency per se to become a hair transplant surgeon. That's the good and maybe the bad side of it. So you have to be a doctor, so you have to have an MD. But theoretically, if you graduate medical school, the next day you can open up a shop and say you're a hair transplant surgeon. So that's the scary part. That's the scary portion of it. So from a patient standpoint, you have to do your due diligence. You really got to do your homework and find out what training that person has had and how much experience and that sort of thing.
Which is what I did. And we'll get into that and why I drove from New York to DC to see you.
I appreciate the faith.
Yes.
From my standpoint, I'm glad I did not have to repeat a residency. My medical school for me was 4 years, and then my residency in urology was 6 years in surgery, and then practice for another 10. So thankfully, I did not have to repeat another 6 years of surgery. But what I did was a year fellowship with Dr. Huebner. And so while I was practicing urology, several days a month, I would fly down to the Florida office and do a fellowship with Dr. Huebner. And initially it was, observation and helping, sort of assisting him in the surgery, being the second surgeon. Slowly he would let me do pieces of the procedure, with his supervision, and then larger chunks. And then eventually when he felt comfortable and I felt comfortable, I did a couple procedures on my own with him there overseeing me. And then once he felt more comfortable, we started doing procedures up in the Maryland office. And then once he and I felt comfortable, he let me fly and sort of,
You've been soaring ever since.
Yeah.
That's so awesome. So what do you do about your certification? Because in urology, it's every 10 years you have to recertify, right?
Yeah. So like I said, because it is not a specialty, there is no technical recertification, nothing like that. Now, you do, to be a doctor, you have to, to have an MD, you do need to have continuous medical education and a certain amount of hours per year and that sort of thing. So, so that you have to keep up on in order to maintain, the MD license. In order to be a good doctor, or is trying to be one of the leaders in the field, like any field, you still should do your homework and try to keep up to the latest and greatest. And whether it's online courses or in-person courses, we try to do everything we can to stay on top of the most recent data and innovations.
That's awesome.
Yeah.
I had a few more questions for you, but you seemed to answer them all. Just about the fellowship program. You did the fellowship program and for about a year, as you mentioned, flying back and forth. If you could describe like lifestyle differences, you pretty much described that. You want to touch on that a little more?
Yeah, absolutely. I think, like I said, that was the leading factor for me, really, to, like I said, find joy, recapture my life. There's no comparison. There's no comparison to what I was doing before to what I'm doing now. So, right now I work. You can make it whatever you want, and I think that's the beauty for me. I have a lot of autonomy and control, and God bless Dr. Huebner. He allows me to do whatever I want. I'm not, as a people pleaser, I'm not one to ask for things, and that was hard. My initial transition, that was actually my hardest factor. Was what is everybody else going to say? What is everybody else going to think of me? Are they going to think I'm a quitter or a loser, not cut it?
Did you get negative feedback from maybe some other urologists?
Not one person, That's one
awesome.
person. But it took me about 6 to 9 months to sort of come to the conclusion, this is what I want to do, and I'm going to do it. And it's embarrassing to admit, but my biggest factor of sort of should I or should I not was what is everybody else going to think? Not what I think, but what is everybody else? What is my chairman from my residency? And this was 10 years, I hadn't been in residency for 10 years, but I was concerned what he was going to think of me, what my fellow coworker urologists were going to think of me, what my fellow residents, that I went through residency with, all my attendings, what my wife was going to think, or my kids. I did not come across one person that said I was doing the wrong thing. Everybody was so supportive. In fact, quite a few times, probably more often than not, the urologist, whoever I was talking with, actually said, I wish I could do the same thing. But I'm too far into my career, or, I can't, from a financial standpoint, I can't do that. But there are several people that said, I'm jealous. I wish I could do it. God bless you. You're getting out. Not one person, said I was doing the wrong thing.
That's awesome.
So,
I think it shows too that sometimes our biggest enemy is here, right in the noggin.
You got it. You got it. Absolutely. So now I work 4 days a week. I do one patient a day. I do one case a day, 4 days a week. No call, no weekends, no nights. Versus what I was doing as a urologist was probably working, my day now is from 9 to probably 4. I was working 8 to probably 7. And 5 days a week I was on call, working nights, working weekends. And when I was home, like you said, I wasn't even home. I wasn't present. And that's really the thing that bothered me the most, is I took work home with me, not necessarily physically, but emotionally, mentally. I wasn't with my kids. I wasn't with my wife. I would be thinking about the day, annoyed, burned out, stressed, or answering texts, answering on call, patients on call. Now, when I'm home, and I get to really be with my kids, and I get to be with myself. And I've found, like I said, my job now is not my life. It is a part of my life, and I'm deep into meditation and yoga and playing guitar and running and exercise and playing golf and tennis with my wife, and it has changed my life dramatically. I mean, it literally has saved my life. Yeah.
That is so awesome.
Yeah.
Wow. So what advice would you give? Let's say there's some doctors out there that's listening to this episode now, and they may feel burnt out and they want to have a more flexible, more fulfilling career as a medical doctor that's still performing surgeries. You still cut and suture as you did me.
Yeah. Yeah.
And so what advice would you give to them? Like, what would the first steps be? Should they Google transplant clinics in America and then see maybe who's hiring? I mean, I know your situation was a little different with it being a friend, but if someone's listening now, like, what advice would you give?
Yeah, I mean, from sort of more of a global advice, I think to really be open to creative options, and unfortunately, like many industries, but especially medicine, it's so institutionalized. I never even knew I had options. Everything is sort of always one track. College, you go to medical school then residency, potential fellowship job, and then you just keep going, and then partner, and so there was. I never knew there were other options. You could sort of take the off ramp to something else or do some hybrid. But there's so many, creative options that you can do. Now, if it works for you and you love it, awesome. That's great. I think, like most things through friends or people or acquaintances, just sort of what they're doing, or friends of friends to sort of see what they're doing. But I think to sort of have an open mind to be creative about what you want and what you're passionate about, or what you want to do, or what you want to change with your life.
That's awesome. Thank you for that. That's awesome. Yeah. So now we're going to kind of switch gears a little bit. And we're going to talk about my transplant journey. So the reason why I know Dr. B is because I underwent a hair transplant. Yeah. And so I'll show some of the pictures before and after pictures, but let's discuss the transplant process. So I know a lot of people, especially women in the African American community, that have suffered with traction alopecia from tight braids and tight hairstyles, eventually end up having permanent hair loss from the in continuous traction. And so in a case like that, there's so many products out there. There are the oils. There's just so much you can do. Never worked for me. And so I got to the point where I was like, I want a hair transplant. And so at the time I was living in New York City, which is like the capital for cosmetics and procedures and everything. And it's so cheap there. But I found a few different centers and I went to visit them. And just something in my gut was just telling me, don't do it. I had a lot of questions because I did a lot of research at the time. I wanted to know how big my scar would be, what type of transplants. There are two different types. What can you help me out here? What are two types?
So there's two major ways to get hair from the back. One is called the FUE, the follicular unit extraction. That's the hole punch technique. And then the other one is called the FUT, or the strip technique. That's the way we do it, where we actually make an incision and remove the hair kind of as a strip.
Yes, which gives you a little facelift too, but
little side benefit.
Side benefit. So I was in New York, and I wanted to speak to the doctors. I just wanted to get face to face with the person who would be slicing my head open and performing my hair transplant.
I would want to know the same thing. Yeah.
Yes, and did not happen. And so I continued to do more research, and I found your employer. So I found Natural Transplants Hair Restoration Clinic, and I watched numerous videos, and it seemed like you guys specialize in the African American community. And so,
we do,
yes. And so,
we found a niche. Apparently, Dr. Huebner was on Dr. Oz several years back, and I guess that is a show that a lot of African American women watch. And in his presentation, he actually showed a African American woman the before and afters. And so, since then, we probably do 60%. 60% of our patients are probably African American. Which is unusual.
Unusual for any other hair restoration clinic. And I noticed that. So that's one reason why I chose the clinic, because I went into New York. I visited at least 3 clinics. I couldn't speak to the surgeon. They wouldn't even allow me to make an appointment with him. I had to make a deposit first. a non-refundable deposit. And I couldn't see any pictures. They had no pictures, before and after pictures of any African American women, which is what I wanted. And
Of course, yeah.
and so I found you guys. I found Natural Transplants Hair Restoration Clinic, and the experience was literally priceless. Like if any other procedure I could get in life could be like my experience there, I would probably get surgery all the time. But I know it's not. Just how you mentioned how it's better for you, it's better for the patient too.
Yeah.
When I came into the clinic, I was the only patient in the clinic. You see one patient a day, right?
I do one surgery a day.
One surgery a day.
Correct.
Right.
Yep.
Like that should be implemented in like that should be standard procedure, because it's less stress on the patient. I know you're coming in with a clear mind, a clear conscience. You're ready to get to work, and you're coming in not from the burden of another surgery that you just finished or another 15 calls or 15 charts or whatever other task that you would normally do. And
or trying to speed through yours to get to my next surgery later in the afternoon. Yeah.
Exactly.
Yeah.
So the experience that I had was just amazing. So when I found you all and I realized that I could speak to you, I didn't even ask. So when I went through the check through process and I spoke to Jerry, and Jerry put me in touch with you, which Jerry is one of the intake, I guess that's its title, right? He's one of the intake personnel. And so I spoke to Jerry. We discussed what I wanted, and he was like, okay, great. Awesome. When do you want your surgery? We can get you scheduled. We can make sure you have a FaceTime with the surgeon. And I was like, what? I get to FaceTime him? And this was before COVID. So you guys have been up to speed with the digital world before COVID.
Right.
So I didn't have to come in. You're like, look, he'll FaceTime you at this time, and he'll see, your condition, and you guys can go from there. And after I spoke to you, if I had any doubts or any fears, they subsided. You answered all of my questions. You were patient. You were thorough. And within a few months after that call, I came in, I got my surgery, and I've been happy. So
that's great.
Yes. So the entire
I like to hear that. That's the way it should be. Good.
Yes.
Yeah.
So I do want to show some pictures and videos. So why don't we quickly walk through the process? I know when I came in on the first day, you use this big old Sharpie and you draw my head to get my hairline together. So for me personally, I had traction alopecia on the sides, but I was like, hey, while I'm doing the surgery, let me bring my forehead down. Let me not be a big forehead girl anymore and just bring my hairline down a little bit. So why don't you walk us through step by step?
Yeah, so the first thing I try to do is calm the patient down.
Yes. Which he is amazing at. So amazing.
Usually I do a couple deep breaths and try to relax the patient as best I can. I have had the procedure done myself. So I had a transplant about 1.5 years ago. So I know how it feels to be on that side. And I do not like needles. I have a phobia for needles, and I do not like procedures done on me. So I know how it is to be freaked out and scared. So I try to calm the patient down as best I can immediately. And then we usually the first 30 to 45 minutes of the procedure is just us talking, again, reviewing the goals, the expectations, what the patient wants to get out of it. Because that's really the most important thing. You're the one paying for it. You're the one looking in the mirror every day. So I want to make sure I give you what you want. It's not it's not about me. It's not what I want to give you. What I think it's what you want. Now, if you want something crazy and odd, I'll have you sign a piece of paper that says, "Hey, this is what I want." But and that's only happened once. But most people are reasonable and they just want it to look natural, and that's really the key. And so, we take some pictures and then we draw it out. And then we can, it's up to you. We can just reestablish whatever hairline you had before. Or if you've always hated your big forehead and you want to bring it down even lower, we can do that. Some patients who've had a widow's peak and hated it, we can, make it so it sort of envelops the widow's peak so you lose the widow's peak. Or if you've always liked it, we can keep it. We can do whatever you want.
Yes.
But again, the making it look natural is really the key.
Right. And so, after you drew the hairline on and shaved my head, which was I was so nervous about, but it grows back.
we don't have to shave the whole head. We just have to
Yes.
shave where we're going. Yeah, right.
Yes,
So a lot of
exactly.
patients are concerned, and they do you have to shave my whole head? No, we don't have
No.
to shave the whole head. We only have to shave where we put the grafts.
Exactly.
And that can be hard. That can be that can be a tough moment for especially women that, you know, you fight for every strand of hair, and then we shave that. You come in for more hair and you leave with less. That can be psychologically difficult.
But we do take it
that
with us. You allow us. You put it in a nice
you
Ziploc
can,
bag,
you
and we
can
take it
with
home.
You can, absolutely. I offer it. And that hair grows back, but it's obviously not the hair that you want. It's more the baby fine hair. But you know, like I said, that can be a tough moment for patients when we're shaving a little bit.
Yes. So after that, we go into the room and get numbed up, and you start the procedure by cutting the back of the head and doing the, what is it that you said, the CT, the type of
the FUT,
the FUT,
the strip procedure.
Yes, the strip procedure.
So usually we give a Valium before we go to the procedure room. I know it helped me tremendously in my procedure day. It did. We still want you awake and alert, but relaxed. And so I was nervous enough. I wanted to be more than relaxed. I was very relaxed, and so I took a little more than normal. But you know, usually we do the Valium, go to the other room. And then the numbing shots are the worst part. So we do numbing injections all the way around the head, and that part is not fun. And but we get you through it. And usually women are tougher than men, as most
Really?
women know.
That's
yeah,
funny.
absolutely.
That's funny.
But
That
after,
reminds me.
Yeah.
I don't know if you've ever saw running through the internet. There's like this machine that can make guys feel like they're on their cycle. It gives it simulates cramps, and it is the funniest thing. Like the guys are fainting, they're crawling. It is so crazy. I'll have to send you the video when I find
Please
it.
do.
But
yeah, my wife will appreciate that.
Yeah.
So yeah, I've never had anyone run out of the office on us, but you know, and then it takes 8 or 9 minutes, and once that's done, the rest of the day is easy. Most people are just, you know, watching Netflix all day. And then we make the incision, and so we make either a 1 or a 1.5 centimeter wide incision from about the back of the ear to the other back of the ear, and we make that incision, and then we sort of cut that strip out, and we cut right underneath the follicles. So like I said, there's 2 different techniques. One is the FUT, that's the hole punch technique. The other is one is the FUE, that's the hole punch technique. The other is the FUT, that's the strip. That's the way we do it. They're both good procedures. They're pluses and minuses to both. The advantage of the strip is that when we make the incision, we're actually with our own eyes looking at the follicles underneath and cutting right underneath the layer of follicles. So it's a little safer to obtain the grafts, the follicles, I should say. We don't really care about the hair. When we do the transplant, the hair itself is dead tissue. We don't care about the hair. What we want to get is the follicle, and that's underneath the skin. That's the seed that grows the new plant, so to speak. So that's really the most important aspect of it. And so we cut that strip out. And then I cut that strip out, and then I suture the incision closed. So it's a nice, thin, tiny little scar.
And I'll show my scar. It's so you can hardly see it. Anytime I go to the hairdresser, no one notices it.
Yeah. Good.
Yeah.
Good.
Yeah.
Yeah. That's
so that
like
shows
I said, that's
you're a good surgeon.
Yeah. Well, and again, that's the advantage of doing 1 case a day, and that's the advantage of the surgeon doing it. There are some facilities where the surgeon may literally not do the case at all. They may be there just sort of signing the paperwork, and the technicians may actually do the surgery. Now, they may be great technicians, and they may be really good at the procedure. We at National Transplants, we'd like to be involved, and we think it's imperative. And so we actually make the incision, we suture it closed. And so, you know, our name's on the door. We want to make it look good. It's important for us that these scars are really thin because it's important for patients. And it's one of the main questions. And so the advantage of doing 1 case a day for me is I get to take my time. I want to make sure it's really, you know, the best I can do with it. And so then after that's stitched closed, the technicians take the strip and they cut the strip up into tiny little pieces, little grafts. Some of the way we do it, you know, again, every place does it a little differently, but the way we do it is some of the grafts that we cut up are only going to have 1 hair in each one, but most of them are going to have multiple hairs in each one. So some are going to have 2, 3 hairs, some maybe 4 or 5 hairs. And then while they're doing that, I make the little holes.
Yep.
So it's like planting a garden. You got to make a hole and then you put the seed in it. That's basically what we do. So I have a little tiny knife device that I make thousands of little holes in, and there's that's where a lot of the artistic portion comes in. So how I make the hole that determines how close the hairs are together, the angle with which they come out, the depth, all that stuff is determined by me, and how the holes are made.
Yes, which is awesome.
Yeah.
And I loved my hair transplant.
Yeah, good. Yeah, we usually have fun, and then usually we stop
Yes.
for lunch and do some bathroom breaks.
Yep.
And then after lunch, the techs take the hairs that they cut up, the little grafts, and place them in the holes that I made.
Yeah. And then you're out of there. So it's like a
And then you're out of there. Yeah.
3.5 hours.
Yeah,
at max.
anywhere. You're there anywhere from 4 to 6 hours, but procedure time it's shorter than that. But it just depends on how the day goes. Again, like I said, doing one case a day, I don't need to rush through, so we stop for lunch and bathroom breaks and all that stuff.
Yes.
And then we go over all the instructions afterwards and what to do, what not to do, how to take care of it. No exercise, don't cover it for a couple days, all that sort of stuff.
Yes, which is simple. They give you a brochure, pamphlet with post-procedure instructions. Someone will call and check on you, including Dr. B himself. It's just great.
Yep.
Yep.
Yeah. Usually I call the next day and check on you, make sure you're not doing anything you shouldn't be doing.
Yep, no planks or anything crazy.
Right. Yeah, no planks.
Head needs to stay upright. They leave you with a cute little neck pillow, which is so soft. Where do you guys get those neck pillows from? They're like these foam.
Sometimes they're on back order, but yeah,
They're like
some are softer than
Tempur-Pedic.
others.
They're Tempur-Pedic neck pillows. They're awesome. So, Dr. B, I know you're not as busy as you were before, but I know you're busy. I'm sure the family's waiting for you, and I so appreciate your time here. Thank you for this.
It's been fun.
Yay.
Yeah, thank you so much. Thanks for walking me through my first podcast. This was fun.
Yay. Awesome. Yeah. Well, again, we appreciate you being on the show. If anyone submits questions or queries to me, and I'll be sure to just maybe reach back out and let you know what people have said.
Please do.
All right,
you so much.
Awesome. Thank you.
All right. Bye-bye.
That concludes today's episode of the White Coat, White Collar podcast. If you like these discussions and want to continue hearing more, please subscribe and leave a comment on the platform that you've tuned into today. For more resources on unique career options for STEM and healthcare professionals, please follow White Coat, White Collar on Instagram, Facebook, and LinkedIn. If you love what I'm doing and would like to be a sponsor to help me continue demystifying the career landscape, please visit whitecoatwhitecollar.com/sponsor. Thank you for tuning in and all the best on your career journey. Remember, take the journey one step at a time and don't be too hard on yourself. You got this. Until next time.